Hi, my name is Emmanuel Ogbodo. I'm a specialist biomedical scientist and I'm also a lecturer in biomedical science here in the United Kingdom. I completed my PhD in biomedical science. I have extensive experience working in an NHS hospital as a specialist biomedical scientist. I have used these experiences to help a number of people navigate through interview questions and therefore get their dream job as a biomedical scientist. I'm here to help you navigate interview questions, thereby increasing your chances of getting a job as a biomedical scientist. What I would ask is that you like, share, comment, and subscribe to our page. Thank you very much.
Yes, guys, so today we are going to be looking at something very important. I told you guys I will be making some more videos for you. So, I didn't forget. Right, let's look at this. In terms of Kleihauer, what is Kleihauer? When do we do Kleihauer? What does it mean? Okay, so Kleihauer is commonly done in a pregnant woman. Okay, when it has to do a pregnant woman or a pregnant woman who is mainly antigen D negative patient. Okay, ROH D antigen negative. So that is when we normally do Kleihauer. So what is really Kleihauer? So I want to give you a little background or story around Kleihauer before we can explain it in detail. Okay. Now, by the way, I'm already getting good news from a number of you guys of hitting the job, getting the job. I'm telling you, this channel will continue to help you guys. That is my dream, and that is why I'm happy when I get that good news. So please do continue to let me know how much the channel has been able to help you. So I want you to continue to watch. The video is not just about getting jobs, it will help you all the way. Okay, right, let's continue. So when it comes to the Kleihauer, I want you to think about a woman that is pregnant, and that woman that is pregnant is O negative or A negative or B negative or AB negative. Basically, that woman is ROH antigen D negative. So imagine that woman is pregnant. Maybe her husband may be something like O positive or B positive. Basically, the husband might be D antigen positive. And that can make the child, of course, to have the possibility of having D antigen negative or D antigen positive. But let's say, for example, that the child is D antigen positive. So if that child is D antigen positive and the mother is D antigen negative, remember about the umbilical cord that connects the baby and the mom. Okay, so let's say for some reasons, okay, due to one or two situations leading to the baby's red blood cells, okay, floating and going into the mom. Okay, so when that baby's red blood cell get to the mom, what do you think that will happen? So I'll tell you what will happen. So because that baby is antigen D positive and the mom is antigen D negative, that baby's red blood cell can cause sensitization on the mom. You see now, so the mom might start feeling a cramp. Okay, the mom might start feeling pain, as the case may be. So that might lead to internal bleeding. So the mom might start bleeding internally because of the sensitization and between the mom red blood cell and the baby's red blood cell. So because the baby has antigen D positive, when it meets with the mom who does not have the antigen D positive, the mom is antigen D negative, the baby is antigen D positive, that mixture can cause sensitization, and that sensitization is why the woman may start bleeding internally or start having a cramp, as the case may be. And that is what Kleihauer measures. So what does Kleihauer measure? Basically, what Kleihauer does, it measures the amount of the fetal cells that is present in the mother sample, and that amount will quantify, will tell us the degree of internal bleed or what is going on internally. So what is the principle of Kleihauer? So what Kleihauer does, that it uses what we call elution techniques. So remember that baby's hemoglobin are mostly hemoglobin F, and adult hemoglobin are something like hemoglobin A. Okay, so what happened that in Kleihauer will elute all the adult hemoglobin, leaving only the hemoglobin F, which is the baby's or fetus hemoglobin. Okay, therefore, when you do Kleihauer, is a staining techniques. So when you do that staining techniques during the washing, elution, and secondary staining and so on, at the end, the adult hemoglobin will be washed off, okay, will be eluted off, while only the baby hemoglobin will be present, of course, if present. Okay, therefore, you find out that Kleihauer uses elution techniques. It removes the adult hemoglobin, which is the mother's hemoglobin, leaving only the baby's hemoglobin if that hemoglobin is present. Therefore, when you do Kleihauer and you see a positive result, what it then means that there is a sensitization going on, there is a bleeding going on internally. And that is why when that happens, once you find out that it's a positive Kleihauer, you then need to do another thing, which is to quantify. So you need to do the cell count, the photo cell count. That amount of that photo cell count that you're going to do using the microscope, okay, will then tell you the amount of the bleed going on in the mother. And that quantification, why is it important? It is important because it will give us idea about the amount or the volume or the quantity of the anti-D we can give to the woman. Remember, that is actually the essence of giving a woman who is antigen D negative. That is why, like the video I made previously about the routine giving a pregnant woman who is antigen D negative, giving the person anti-D. The whole essence of giving that anti-D to that a woman that is antigen D negative when the woman is pregnant is so that that anti-D will go and coat the mother's red blood cells, okay? Helping the mother's red blood cell, okay, to start behaving as though it is antigen D positive. It will coat it, and that coating will then help it to be floating. Once there is any antigen D positive red cells, it will bind it. Do you understand? So it will take care of it. That is why we give that routine anti-D. Anyway, so even when a woman is on that routine anti-D, in some cases it may not even stop this internal bleed when it happens. So that's why when we do the Kleihauer, okay, and you notice that level of bleeding, it helps you to do the quantification, and following the quantification, you can then know the amount of anti-D that can be given to that woman, even if that woman had already had anti-D routinely. So let's say, for an example, a woman had anti-D at 28 weeks, maybe at 30 weeks, the woman started having cramp, as the case may be. Remember that after 28 weeks, ideally, the next one's supposed to be post-delivery. But let's say at 30 weeks, 35 weeks, the woman start feeling any form of sensitization or cramp, as the case may be, and then you do Kleihauer, it is positive. So when it is positive, you quantify it. When you quantify it, you then work out from the quantity, the amount of additional anti-D that can be given to that woman. So that's the sense of doing the Kleihauer. I've told you the principle of Kleihauer in terms of the elution, eluting the adult hemoglobin, leaving only the baby cells, okay, which is hemoglobin F. And when it is positive, you do quantification. You are doing quantification because it will help you to know the amount of the quantity of the bleed going on inside, okay, that can help you to determine the amount of the anti-D that can be given to that woman. Now, let me do the mathematics for you. It is recommended that about 500 international units of anti-D can take care of 4 mil bleed. So let me repeat that. 500 international units of anti-D can take care of, or is recommended for 4 mil bleed. Therefore, if somebody is having 8 mil bleed, you can give 1,000 international units. If somebody is having something like 12 mil bleed, you can give 1,500 international units of anti-D. Now, let me also give you another thinking about this. Let's say somebody is having something like 10 mil bleed. You still need to, if somebody is having 10 mil bleed, remember that 500 international can take care of 4 mil. 1,000 international units can take care of 8 mils. So when it is 12 mils, you need at least 1,500. Okay? So you need, that quantification will help you to know the actual amount. So instead of it not being enough, you should give over of the anti-D, because that anti-D will not cause any problem to the woman. Instead, it will actually help the woman to go through the process safely. So that's what happens. So remember the function of why we do Kleihauer, okay? and also the principle of Kleihauer's and the quantification, how it can lead you to determine the amount of anti-D that can be given to that woman. So here you go. That is what it means when you think in terms of Kleihauer. So they ask you, what is Kleihauer's? What does it mean? What is a principle? Whichever form that it comes, it has to do with this story. Make sure you give them this story. And once again, thank you so much for your time. I hope these videos will continue to help you guys to continue to get that job. Thank you till I come back your way again. Bye-bye.